I think my mouth made more of a noise than my body. Oh, wow.
Chiro cracks. Chiropractics for everyone.
Let's start with neck and back and shoulders. How are you feeling?
And neck has been absolutely terrible. Back has been better than that. Shoulders are the worst, though.
Shoulders are the worst. This thing sucks right here.
Yeah, like that hurts.
Not as bad over here on the left, right?
Yeah.
I think we do have some levator scapula on the right side. We're going to have to work on this muscle a little bit and release that.
I feel it.
But that's attached to C2. A lot of times when we adjust C2, 3, 4, this muscle will clear up on its own. Well, this feels, you feel that bubble right there?
Yeah.
There's definitely some swelling in your neck. Anything else to report? Any accidents, injuries, incidents?
Not really.
Okay, new job, new postures. Those things are all valid. How's your stretching routine?
Don't have one.
Okay. Well, that's an immediate area of improvement.
Yeah.
Are you drinking enough water?
Yes.
Okay. Otherwise, life is good. No traumas, no hospitalizations, no changes in your medicine.
Oh.
Do you take any pharmaceuticals?
All of the above. There's changes in everything.
Okay, give it to me. What do you got?
I've been having to take certain types of medications, if not like a lot of pain medications, due to recent dental surgeries and procedures. So that's been very inclusive in my daily routine.
How many surgeries did you have?
5 surgeries and 3 procedures, like actual major surgeries.
You alright? What's happening?
My molars are just failing. Genetics. I have 2 more surgeries and 1 more procedure. So on top of that, lots of mental stress, which in tune has turned into physical stress.
Okay, headaches?
Sometimes.
Once a week, once a month, more or less?
Probably a couple a week.
How do you feel here, right versus left? Is one more tender than the other?
Left is more tender.
Okay. Left, right. Do these feel the same?
Kind of, yeah.
Okay, that's good. This is a fascia test to see how the fascia and the scalp are moving. This is the sphenoid bone, checking the sphenoid bone for tenderness. We'll adjust this along with the rest of the cranium as well. We'll look at your jaw. We'll try to loosen up some of these muscles, do all the cranial adjustments that we need today. Take care of the shoulders and the neck. We'll see what's happening in the rest of your spine too. This will definitely take tension out of the head and of the neck, help you feel a little bit more comfortable. Both feet are slightly pointed to the left, but that's pretty good. All right, now just stop right there. Okay, so starting from the knee down, looking from here, we're looking for straight lines all the way down. There's no genu varum, no genu valgum, no bowing in or out, no knock knees or bow-leggedness. Both feet were pointing towards the left during the march, and I can see that this right knee is slightly angulated and pointed in. That rotational stress is going to cause stress on the outside of the right femur. Now, all these things are normal. No one's perfectly symmetrical. We're just looking at indicators of where the best place is to adjust, where there's the most stress in your spine. Then looking at the hip height, go and put your hands on top of your hips. Okay, so the right hip looked higher when we were just observing. Now drop that. So the right hip is higher, so that should mean that this right hip is twisted posterior and inferior on the right. When the arms drop, there's still more space on the left than there is the right. So we're just looking at a slight little lean in that direction. The shoulder height is like impeccably even. Congratulations on your even shoulders. I never see that.
Thanks.
Shoulder height from the bottom of the scapula, still very close to even, slightly higher on the left. From the side, we're matching up the external auditory meatus with the midline of the humerus. This measures whether or not there's forward head posture and indicates if there's any loss of the cervical lordosis. You can also see if there's any sway back, any accentuated hyper or hypolordosis of the lumbar spine from the side view. Very simply, head over shoulders over hips. Is there a slight increase in the lumbar lordosis for Lexi? Maybe very slightly, but again, normal for her. Checking from the back, we did have a right high hip, so that means it should be the lower glute fold. So we're going to look at the glute folds and see if there's any rotations in your hip. Sliding up to the bottom of the glute fold, they look very even, but it's slightly lower on the right versus the left. Then looking from the top view, we're looking straight down to see if one is more accentuated on one side or the other. That tells us if there's any external or internal rotations looking from the top view. To verify any rotations, internal and external rotation, it tests for hypertonicity of the glute fibers, okay? So checking the top of the gluteal folds coming across the top of glute medius minimus out here, then glute maximus more centralized here. checking for hypertonicity, checking both sides at the same time. They're very even on both sides. This is bilateral, symmetrical, no pelvic distortions here, very little shoulder distortion. All of this can change potentially when you start walking. Not a runway walk now, Lex. I just need a regular walking into the sandwich shop, okay?
That's the same walk.
Is it?
When I go to the bodega, I'm like, give me my sandwich, and I'm just like, I'm gonna get my giant ass hoagie.
Okay, you're hilarious. The feet are the most important element of the gait analysis. Heel strike, mid-stance, and toe off are analyzed for any supination, pronation, inversion, eversion, or external and internal rotations. Lexi's feet are straight away. I don't see any deviations, no supinations. I don't suspect any flattened arches. And there's no bowing of the Achilles tendon. Okay, we had a high right hip in the room. It looks like it remains high here in walking. That's good. But now the right shoulder, now the elevation of the shoulder does come out a little bit more. It's accentuated when you're walking. So it's part of the function. We're looking at functional discrepancies now. Before, a static posture doesn't show us the function as much as the structure. Now we're looking more at the function, and we can see the right shoulder coming up a little bit higher. And then looking at the ears, we can see the right mastoid process coming up a little bit higher. So high right shoulder, high right mastoid process. The hip swing looks even from left to right. I don't see any discrepancies from the left to right on the hip swing.
Oh, no.
Looking at the Achilles tendon here, this is normal, straight up and down. There might be a slight pronation on this left foot here. Okay, temperature evaluation is done with the back of the hands because the back of the fingers are more sensitive to temperature. Nice and cool and symmetrical, bilateral all the way down from the mid-thoracic spine here. We definitely have more heat once we get up into the interscapular area and then the top of the spine. Actually, it's right here at about T2, T3 is the most amount of heat. Symmetrical from left to right, if not slightly more on the right. Everything, the total, the conglomerate, the amalgamation, everything put together, it all releases a bioelectromagnetic signal at finding where the tone changes or where it's different from one side to the next. The dimples here identify the S2 segment. The second sacrum segment is right here, and this is the superior portion of the SI joint. So first we just feel if there's any swelling there. Then do you have any tenderness here on this side?
Yeah, a little bit.
How about down here? This is lower SI.
It's about the same as.
Okay, what about this left side? Any tenderness there?
Not as much.
Okay, any tenderness here in the lower SI?
Probably the same as the right side down there.
Okay, which one's more, right or left here?
Right there, the left.
What about here, right or left?
Right.
The spine tells a slightly different story when you're laying down because all of these muscles are now relaxed. All the spinal column muscles are relaxed. So we can dig a little bit deeper into the deepest layer where we find the rotatories muscle and the multifidus muscle. Let's start with this one. Go ahead and bend your knees.
Both?
Yeah, bend them up. Good, we're going to bring that to here. How's your low back? Any pain, discomfort, tension in your low back here?
No.
Let's palpate the sacrotuberous ligament and see if there's any tenderness there on either side. Okay, right or left here?
A little more on the right.
Still tender right there?
Mm-hmm.
Okay, I'm going to keep my thumb right there. Is this tender up here?
Mm-hmm.
Test that segment again. All right, how's this feel now? Same, better, worse?
Definitely better.
Yeah, it's a pretty amazing technique. Shoulders sinking in. Good.
I think my mouth made more of a noise than my body.
Same thing. Shoulders relaxing in there.
Oh.
Breathe, yep. Keep going. One more. Good, all the way down. Okay, Okay, so the left SI joint was the one that was tender at the bottom, and this is the short leg. So this is the posterior, inferior, and we got to adjust from the lower SI joint. So I'm going to lower your band into the lower SI joint. Take a deep breath in through your nose, good and out. We're going to bring the shoulders up like this. Good, like so. Bring the hip down. Good, following this breath out. Good. Good. And you're back. And you're back.
That noise was the table, not me. I would admit it if it's me. I have no shame. That was not me.
Okay, nice and gentle breathing in through your nose and out. Good, shoulders sinking in. Let the hips relax too.
Felt that one.
It's tender under here, isn't it?
Mm-hmm.
Okay, nice and gentle breathing, sinking in. Good. You can close your eyes. Nothing to look at out here. That just helps you relax a little bit. Good.
Oh, yeah.
There's a couple of things happening here too.
I feel them.
It just needs a little bit of rotation in it. Okay, so this is a different kind of adjustment. So this one's over rotated in the opposite direction. So I'm just gonna very gently lift it up in that direction like that. Okay.
Mm-hmm.
Oh my god.
That was probably the cutest crack I've ever heard. Wow.
Relax. Let it go. Got it.
Oh my god, that one felt so weird.
Let it go.
Oh, here we go.
How's it been down here? Okay.
I feel like it's always a mess.
Okay.
Sometimes I'll wake up in fetal position, just like, it's terrible. I remember the last time you did this, like, I noticed such a significant, just like breathing quality. I think on the way here, I was so strained with like singing the last time I came. And then when I went home, oh my god, it felt like I had new lungs. Like, yeah, it sucked when you did it, but oh my god, did it help.
We'll start with the ileocecal valve. First, one finger on the umbilical here, ASIS here, tracing down the middle. So we'll begin looking for this valve. Good. Yours isn't too bad right now. Feels like you're pretty empty though. When's the last time you ate?
A little before 9 a.m.
You're starving.
Mm-hmm. At this point in the day, I would have already had like 3 meals.
Deep belly breaths. Good. Okay, almost there though. It's right there. Deep breath in. Okay, that's good. Keep going. It's almost there. It's just stuck. It's right at the end. Good shoulders and hips.
Oh.
Hips.
Oh, yeah. Oh, wow. Forgot how good that felt. Oh, God. Oh. Whew. Like, it feels great, but I definitely would not go for a jog right now.
It takes a minute. Just give it a couple minutes.
That was amazing. I mean, I'm feeling it, Mr. Krabs. Oh. Yeah.
Good.
My body's like kind of sore up in my neck, just kind of like in my back, and then like my hamstrings.
Which one of those is worse? Or are they about the same?
Probably like my lower back.
Do you get headaches at all?
Sometimes.
Okay, how often do you get a headache? Is it like once a month, once a week?
I get like tension headaches sometimes, maybe like once a week.
Alright, so when you get a tension headache, what do you do for it?
I would just like rub my face.
How do you know about all that?
because I'm a massage therapist.
Okay, massage therapist. Very good.
I am.
How long have you been a massage therapist?
Well, I just finished school, so technically I'm not licensed yet, but I have been practicing for like 2 or 3 years.
You work out?
Mm-hmm.
How many days a week?
Maybe like 3 or 4.
Okay.
Well, I run every day.
All right, how long have you been a runner for?
Like as long as I can remember.
How old are you?
I'm 23.
Okay.
I had to think about that for a second because my birthday just passed.
Do you take any supplements? Any herbs, vitamins, minerals?
I take probiotics and I drink chlorophyll. Sometimes I take L-theanine and like vitamin C, but more so on like an inconsistent basis.
All right, have you ever had any major accidents or injuries?
The only time I've ever felt like something major, I was in a car accident and I had like a lacerated spleen, but that was it.
Have you ever been to a chiropractor before?
I have not.
How do you feel about it?
I am a little nervous. I'm excited though.
Okay, looking at the feet first, there's a slight eversion on the left side. All right, right high shoulder. Turn around, go the other way. Try to do equal arm swing. Just try it. Okay, so now the arm swing is equal on both sides, that we brought some awareness to it, that's fine. All right, looking at the hips, restricted moving to the left. Very strong. What sports did you play?
I cheered.
Tenderness?
Oh.
Tenderness?
No, only on the right side.
How about here? Tender?
No.
Here. Upper SI.
Mm-hmm.
Here?
Whoa.
L5. Yeah, it's all down here. Your lower back is working much harder. Looking at your hamstrings and sliding up to the glute fold, we're lower on the right and higher on the left. That means that this right ilium has possibly, you can relax here, the right ilium is possibly rotated posterior and inferior like this, or the left ilium has gone anterior and superior like this. Observing your spine. For scoliosis, there's no rib humping here. Let your head relax. That's good. No rib humping. Very symmetrical and even. No scoliosis in your spine.
I'm not so scared about my back. My neck is like scary.
One of the things that I attract is people who have never been adjusted who are scared. And the reason is because I take my time, I go slow, and I explain everything.
Okay.
And by the time we get to your neck, I'll already have adjusted you like 6 times in your back and your hips. So, like, you're going to be more comfortable by the time we get there. Do you have any pain, discomfort, tension when I push there?
No, I don't feel like any pain.
Okay, I'm going to come to the top of the sacrum. Do you feel it there?
No. My muscles feel a little tight. Oh, I did forget to tell you, I do get shin splints.
You're a runner and you have pronation issues.
Yeah, so it's just like a constant thing. I forget that it's even like...
It's constant? Left should stay short.
It feels weird.
Pressure's okay? Sinking in shoulders.
Okay, that was not as bad as I thought it was going to be.
Good.
Whoa, that one felt weird.
Let it all go. This is how we adjust the low back, okay? I'm going to bring your shoulders in this direction like this. I'm going to bring your hips down like this. Then we're going to push like that, okay? All right, turn your head so your face is straight that way. Okay, that's very good. Good. Breathing in and out. Good. Let this relax here. Good. Good. One more time in. Good. We're going to bring this down. Good. On your back.
Whoa. Whoa.
So what you're going to do is turn your head to the right. Center. Now to the left. Center. Bring your left ear down to your shoulder. Good. Back to center. And then one more time, turn to the left. You just keep doing that ocean breathing.
Okay. What should I do with my hands back under here?
I
am scared.
Totally fine. I'm gonna do it as gentle as I possibly can. So what's gonna happen, I'm gonna bring your head over to the side like this. You're doing good. I'm gonna use my fingers. We're gonna come over to the side like this, and then right from there, we're just gonna gently push like that.
That feels weird.
Of course it feels weird. No one's ever cracked your neck before. All right, we're gonna do the left side first. Gentle, 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 gentle. Coming over to the side, we're gonna push in this direction.
It feels like really like,
Blocked.
it feels like tender. Yeah, like
That's why we need to do it. All right, gentle, 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 sinking, 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 falling into the table. That's a good breath. Good breathing out, feeling it. Good.
Oh my God, whoa. That was crunchy. Okay, it didn't hurt though.
Didn't.
Didn't hurt. I felt like tingles. It was good. Not as bad as I thought it was gonna be. It felt like whoa.
Just checking. Let me check first and let's see. 7, 6, 5, 4, 3, 2, 1.
Whoa, that felt kind of weird up there.
Sinking, sinking, sinking.
Oh, I'm scared for this one for some
Why?
reason. I don't know.
Why?
I started freaking out.
Go to the ocean. Put yourself in the flow. You just found a seashell. It's beautiful. It's a spiral.
Okay, that one, like, I didn't even, like, feel it. Like, I heard it, but I didn't feel like I felt it. I was definitely somewhere else when that happened. But it felt good.
Whoa, dude.
My feet are cold.
Very damp and cold. This is how we adjust the pubic bone, okay? Okay, you're gonna squeeze my fist in between your knees like this. Go ahead and squeeze hard as you can.
Whoa, that was crazy.
Start with the ileocecal valve. This is the window in between the large and the small intestine. I'm gonna start with your navel here and your ASIS, front of the hip bone. Connect these 2 points in the middle.
Oh, is this gonna make me have to go to the bathroom?
Maybe. Coming up to the pyloric sphincter. This is where the stomach empties into the duodenum. Breathe.
It feels not as tense.
Loose.
Whoa. What the
Back hurts a lot all the time, and my lower back hurts a lot all the time, and the right side of my back, I actually have like overgrown like muscle basically on that side because I didn't evenly train my body.
What hurts more, your upper back or your lower back?
I'm like middle to lower.
Okay. Do you get headaches?
Sometimes.
Like once a week, once a month?
Once a week probably.
When you get a headache, where is it on your head?
It's like up on the sides kind of, not really much in the front.
Do you ever get pain that goes down your arms? One arm more than the other?
This shoulder hurts sometimes more than the other one does. My knee is messed up though.
Okay, how'd you mess it up?
One time I was just picking up something after like a really long day. I was hiking and I just like bent down and I heard a really loud popping noise. Like I heard it and I felt it. And then it was really painful and it actually swelled up a lot. And then the swelling went down after I wore a like knee brace on it for a while. And now sometimes there's like this piece, I guess, something like that kind of pops in and out of place. So I don't really know what that is.
Like the popping in and out, like do you feel that? All right, very good. Do you ever get any pain down your legs? Any numbness or tingling in your toes, feet, legs?
Ankles sometimes.
Do your ankles hurt? You have pain there?
Yeah,
One more than the other, both the same?
both the same.
Hips?
My hips hurt a lot.
All right. Where?
They're just very sore, like kind of around the back. One time I had a tonsillectomy and I like lost 30% of my blood.
Anything else? Any other surgeries? Any other wisdom teeth?
No.
Okay, cool. Good for you.
Yeah, right? Good for me.
Yeah, it's rare. It really is.
Yeah, I
It's
know.
really
I'm pretty
rare.
cool.
You're cool. Not for that though.
No, I think that's my party trick. It's just like being like, haha.
Let me
you guys
say.
sat down.
Do you get jaw pain?
Yeah.
Yeah, you have really restricted. Your opening movement there was really restricted. Yeah.
Do I not talk about this all the time? Yeah, I have a lot of pain on the sides of my jaws.
Walk towards me and turn around. Walk all the way. Very heavy on the heel strike. Mid stance and toe off looks symmetrical. Good. Good. There is just a little bit of wobble towards the left on the left hip, and then restricted movement to the right. Shoulders look pretty even. I don't see a difference in the shoulder height, and the arm swing looks even as well. Good. I do not see any pronation or supination, but also I can't see the Achilles tendon. Okay, I'm gonna touch your feet. Okay.
Okay.
All right. So just checking the arches. We definitely have some pronation on the left with a decreased arch there, and that's okay. Put your hands on your hips like this. Okay. Move your hands. I'm gonna place my fingers on your hips. Okay. Slightly higher right hip and slightly higher right shoulder, but very symmetrical. That's like the most symmetrical posture ever. Okay, so I'm going to do a very gentle scan on the top of your spine. All right, so I'm going to do a temperature scan with the back of my fingers like this. This is it right here. This is where all the heat is, in between the neck and the shoulders up here. You're very strong here, though. You have good muscular development, and it's very symmetrical. But this, right here, this is what you said, right? Yeah. All right, I'm going to push a little bit deeper into your muscles, okay? Good. Good posture adjustment there. Is it ticklish? Does it hurt?
Yeah.
Any pain, discomfort here?
Yeah.
When I push into here, it hurts up here?
Yeah.
So you're going to feel my fingers on the back of your hamstrings, okay?
Okay.
All right, so I'm going to slide up to the bottom of your glute fold, and it's slightly lower on the right side, meaning the right side has possibly gone posterior like that. Now looking from the top, they look pretty even. Go ahead and bend forward and touch your toes. No rib humping here, but like just this musculature is much more developed. Okay, I'm going to push down into your hips. Do you have any pain, discomfort?
Yeah.
But this isn't that sensitive, is it?
No. But that is.
The underdeveloped muscle side is sensitive. The right side's all beefy and like, ugh. We're going to adjust your SI joints here. Now we already got a pop out of that right SI joint when I pushed into it, so that's most likely hypermobile.
That was crazy. Did you hear that?
I heard it, yeah.
That was weird.
See how it like is a little tighter there?
Mm-hmm.
I'm going to do another one. I'm going to push just a little teensy weensy little bit harder, okay?
Okay.
Shoulders. I'm going to bend your feet. Don't help me, okay? Okay, elbows in. Keep your fingers crossed and then elbows in. What happens for this one is that you're going to breathe in, and then as you breathe out, we kind of lean back, but hold the slouch, okay?
Okay.
Oh, yeah. Oh, yeah, oh, yeah, oh, yeah. That one spot is going to need some work. There's more. Good. Laying back. Okay, you're breathing. Good. I'm going to bring this down all the way. Bring your back. Look to the right. Center. Left. Center.
What the? crazy? What? Never seen somebody crack somebody's neck like that. Cool. Cool.
I'm going to put the microphone next to your stomach and try to make it happen. I want you to calm it down now so that we can get it on microphone.
Stop. That is not happening. No way, dude. Nice try.
So first we start with the ileocecal valve. We're going to locate this first. I'm going to find your belly button, okay? And then your ASIS, okay?
Okay.
Just with 2 fingers each, here's your belly button, here's your ASIS. We connect these 2 points. Here's your snacks. They're all coming down the chute. Sounds like water. That's just water.
Sorry.
But after I'm done, it'll hurt less. Okay, ready? Put your hand on my hand so it's not as ticklish. It's right there.
Sorry, that tickles. Oops.
Okay, now, go ahead and open. Okay, now push your jaw to the right. Strong. Open halfway. Left. Good. Open your jaw halfway. Good. You're going to just try to relax your jaw as much as you can. Good. You're doing good. All right, let's try this. Open all the way. Now close. Okay, open. Close. Don't take this the wrong way, but after a good jaw adjustment, you gotta keep your mouth shut.
Okay.
Okay. I do this all day, every day. No one gets hurt, okay?
Okay.
All right, deep breath in.
Oh my god, what the fuck? What the?
Breathe.
What the? I like. Can I get up now?
Yeah, if you want to, or you can just lay there for a minute.
Whoa.
Well?
Did you see that? I wasn't the only one that heard that, right?
I'm not sure. What?
I felt like
Oh,
my
yeah.
whole, like the entirety of my back just cracked at once.
Yeah.
Like knocked the breath out of me.
Yeah.
That's crazy. That's wild. That was sick.
That's cool. Push. I'm gonna pull this up just a little bit. Good.
What? Feels great. I'm chilling. Oh, you like.
Oh, mamma mia! I'm dead.
Well, back pain I have since my childhood, and I didn't know what's the reason. And only a few years ago, we think with my doctor from my home country that probably it happens because my right leg slightly shorter than left leg. I know in centimeters it's like a little bit, just a little bit, so it's not like that. So it's like quarter inch, even less, right? But if I stand up, you will see with my bones, they're a little bit not equal, and probably this one provoke like pain in my back. And if I stay 1 hour not moving, I will have this pain. So I mean, when I'm walking, it's okay, but when I just standing for like, let's say 1 hour, yes. And my neck, yes, pretty much often I do have some pain.
Okay, great. Okay, I'm glad that you're doing the exercises. Let's talk about the back pain for a minute. Do you ever get pain that goes down the back of your legs?
And not here. Also, since my childhood, I have huge pain here. It's like it feels like it's like scratching, something like that. Feels like, let's say I walked on heels 12 hours, and after that you have this pain. But I didn't walk. It's like swollen, and it can happen even if I stay at home all day. It's happened for no reasons. I still remember when I was very little, like 6 years old. I really remember I was like screaming because it's so painful. Then when I'm getting older, it's just like disappeared, but sometimes it's still coming back.
Okay, so that comes back when the weather changes?
Yeah, like
Okay.
this part. And usually I hate, I have pain in any joint, like here or here. And it helps if I do some little bit massage, yeah.
Okay, but no one ever came up with an answer for it? All right, so tell me about your neck again. So does your neck hurt every day or a couple times a week?
No, not every day. It's even not a couple times a week. It's less. It's like probably, I don't know, like a few times per month. To be honest, I feel it's very, depends on my mood. When I'm very stressful and I work a lot, it's really like pain.
So, did you grow really fast? Did you have growth spurts that were pretty extreme?
First of all, my height and my measurements, it's the same since I'm 12, 13 years old. It's same height. I used to be 5'10".
Have you ever been to a chiropractor before?
No.
How do you feel about it?
I don't know. A little bit interesting, a little bit scary.
I'll look at your spine, I'll see what's happening, and then we'll do an adjustment. When we get there, I'll walk you through the whole process. We'll go step by step. Okay, looking at the feet first, we got heel strike, mid stance, and toe off. God, you can just don't pay attention to what I'm saying. I'm just talking. Turn around and go back the other way. Okay, I don't see any pronation, supination, inversion, or eversion. The feet look very symmetrical. Coming up to the shoulders, turn around and come back this way. Coming up to the shoulders, we definitely have a high left shoulder, but it's slight, and I don't see any compensating head tilt of left lateral flexion, which is good.
I'm walking like that, I swear.
Now that you're more relaxed, you did compensate and you went left lateral flexion. I could already feel a big difference in temperature. So I'm going to come with the back of my hands, which is more sensitive to temperature. It's very cool in your low back. It's cool, and then up here, it's on fire.
Is it like a bad sign?
No, it's not a bad sign. It's just a sign.
Okay.
That there's a difference. But the good thing is that it's actually equal from left to right. You know, I'm getting a little bit more here in the lower right lumbar. The lumbar muscles here in your low back, the lumbar muscles feel symmetrical. Okay, let's palpate the SI joints here. Do you have any tenderness here? How about this left side? Is this tender at all?
I can feel it, but I would say a little bit more on the right side.
Okay, and then looking from the top. Good. The right glute is out further. The right glute is out further. That means the ilium, your hip bone, is rotated like this. Or your left one is rotated in like this. Very a little bit to the right, but very minimal. Mostly to the back. Good. We might have a hypermobile segment because I do see it really wants to dive off to the right there. I'm going to bend your knees. Let me do the bending here. Don't help me.
Okay.
Do you have any pain, discomfort, tension here? Here. Here.
No, I don't think so.
How about this one? Okay, we tender here. What about here?
Oh, yes, here.
Good. We'll follow this breath out this time. Okay, not bad. You did good. You did good. Good.
Wait.
Breathe. That was perfect.
No.
It was.
No.
Good. Shoulders. Good. Let it go. Good. Let it go. Let it go. All the way. All the way. Gentle. Good.
Wait.
Okay, that's not so bad, right? They didn't hurt, right?
No, it did not. It just felt so bad. And also, in that location in my muscle, when it's happened, I feel like something like warm up, you know, like warm. Like it's like blood circulation.
Yeah. Good.
Oh, mamma mia. I'm dead.
Okay, nice and gentle here. Breathing, shoulders sinking in. We're just gonna do gentle. Good. Following your breath, just letting it all go. Good.
Oi, 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 oi.
Yeah, now it doesn't hurt. Ow! I know. That sounds so bad.
Breathe, let it go. Good, one more. Good, let this relax, let it all go. One more.
Go.
Push, 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 push.
Oi.
Push.
Is also correct?
Hold.
Oi, 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 oi.
We're going to start with the ileocecal valve. This is the window between the large and the small intestine. We find it first by finding the belly button. Yours is right there. Good, there's a little bit of movement there. Good again, man. Good, one more. Almost there. It's almost there. It's going to turn the corner and it's going to disappear. Watch. This is a full spine adjustment. Okay, so I'm going to use the towel to support your neck. You okay with that?
Yeah.
It's okay. It's going to be fast.
Okay.
Good. Following this breath out, just like that.
Oh my god, it's so
Breathe.
bad.
Breathe.
Oh, I'm dying. You killed me. So probably I'm 5'11" now. Really feel like 5'11".
Let's see. Walk around a little bit. Let's see how it feels.
It feels very straight. It feels like I do have like spine from my head till my toe inside of me right now, and I can't even really bend because it's like hold me. You know what I mean? Yeah, just be careful because this part I have tension sometimes. Oi.
Lay your back.
Whoa. Whoa. My neck is always really tight, like all the time. I'm a side sleeper, which I wish I wasn't, but I think that's part of the reason why. But I've always had like a really tight neck. My shoulders always hurt, and my upper back is like particularly like a problem area. But I think from my job modeling, my lower back has also kind of gotten messed up. But my upper back has been bothering me like my whole life.
Which one's worse?
Probably the upper back because it's constant. The lower back is kind of like more triggered by a busy day at work. The upper back is constant, and it's been like probably since I was like 16 or so. It's really hurt.
Okay. Is it worse in the morning or at night?
Usually at night if I have like a busy day or something like that. I do a lot of yoga, so that helps. If I have time to do yoga that day, on days that I don't do yoga, I notice a huge difference. So.
All right. So do you ever have any pain down your arms?
Yep. I do. It kind of comes and goes. It's actually been a little bit better in the past few weeks because I started seeing a chiropractor because it was getting really bad. But I do notice a lot of tightness stemming from my shoulders down like the back of my bicep.
Do you have any numbness or tingling in your fingertips?
No, not really. Not on a regular basis. I feel like I have like maybe I feel like sometimes if I like have something weird happen or I like somehow overextend or something, I'll feel like a shooting pain that sometimes has that for like a second, but it doesn't happen often. It's like only if I'm like, oh, I shouldn't have done that.
All right, do you ever have any tension tightness in your legs?
Yep. All the way down.
All right, so we'll do that. We'll check your spine for scoliosis, and we'll do a general examination, and then I'll get you adjusted, okay?
Cool. Sounds good.
You're from New York?
Mm-hmm.
This is not a New Yorker walk. This is a
Guess I've been in
southern
Florida too
stroll.
long and
This is
slow.
definitely a southern stroll. All right, walk back towards me. Okay. Okay, looking at the feet first. I don't see any pronation or supination. Heel strike, mid stance, and toe off. Looks symmetrical. Okay, you can come back this way. Okay, I don't see any valgus or varus stresses on the knee and the lower extremity. That's good. Looking at the shoulders, there's a high left shoulder. The arm swing looks normal from left to right. Okay, I don't see any excessive swinging on one side or the other. Good. Okay, looking at the hip swing. Okay, looks like we have a higher hip on the left, and it's moving accentuated to the left and stuck on the right. a little bit of a rotation there on the left foot forward at the very end. And you have a little bit of like that postural, like I sit at a desk and look down. Yeah, so you just straightened up and that looks so much better because you lifted from here. That's like when you're trying to lift from up here, you know, that's how you correct your posture. So that's good because if this starts to curve too much, then this will start to curve too much too. Okay, this is a temperature differential. It's measuring the differences in the heat coming off the back of your spine. 2 places. Here, this is where it's significantly warmer. Yeah, so the right fold is lower on the right, which means this right side it maybe has gone posterior inferior like this, or the left side anterior superior. And then looking from the top, we definitely have some prominence on the right. Okay, so a little bit of that rib humping on the left side. So the curvature for you, the rotation is on the left, which is rare. Try to relax your hips as much as possible. There you go. Any tension, discomfort when I push here?
Not really.
Okay, right short crosses over, becomes the long. That means you have a PI on the right SI joint. Okay, this one's a little bit different. This time we push at the top of the breath, so you're going to take a deep breath in, all the way in, good end out. Okay, this is how we adjust the low back. Let this relax. You're going to breathe as you breathe out. I'm going to bring your hips down. We're going to push like that, okay? Out. Back. Turn your head to the right. Center. Left. Center. Letting the head relax, shoulder relax. Good. Shoulders. Good. Good. Here we go. Here. Good. Let's do this. Squeeze my fist in between your knees. Hold on. Let me get my fist there. Squeeze. Squeeze. Feel that? All right, I'm going to do a digestive organ manipulation, okay? Nice deep breaths. Okay, this is the pyloric sphincter. This is the window from the stomach into the small intestine. Yours is clear, a little ticklish.
Yeah.
Okay, ready? Put your hand on my hand. Makes your brain more.
Oh yeah, that's weird.
Like
it really
awareness.
did stop tickling right away.
Yeah. Breathing. Deep belly breath. Just your belly. Don't move anything else except for your belly. Oh, wrist crack there. Okay, I'm going to lift up your head just a little bit.
Whoa. Whoa. That was intense.
Did you feel it all the way down?
Yeah.
Walk around a little bit. Let's see. Take a quick test drive.
Whew. Yeah, it definitely feels different. I feel like kind of some, like, I guess a little tenderness, like, through here, but, like, not in a bad way, just in, like, a stretch way. Mm-hmm. And I kind of just feel more, I guess, even. I do feel taller. I don't know if that's just in my head, but I almost feel a little taller. It's cool. Nice.
Push. Okay. This side. Push. Push. your chin down to your chest. I'm going to reach in the front and then hold on to your elbow, okay, like this. Okay, lean forward just a little bit. Okay, let this relax, loose. Let this relax, loose, loose, loose. Okay, let that go.
That was quick.
Like I have some like lower back pain sometimes, like when I'm stretching or something, like I feel it in my lower back.
How often do you feel that?
Every time I stretch.
Okay. Do you stretch every day?
Like my hamstrings like this. Yeah, I try to.
What do you stretch for?
I go to the gym.
Okay.
Like to stretch before the gym and then after.
Have you ever had any pain that goes down your legs? Have you ever felt it in the back of your leg?
No.
Do you ever have any neck pain?
I do have tension in my shoulders.
How often do you have the tension in your shoulder?
My job after work, especially, it hurts.
Okay. What do you do?
I work in a factory. I like stack plastic basically. It's like a plastic packing company, and I have to like keep doing this motion like for 6 hours. So.
Okay. Just the right side?
No, it's both sides. It's pretty even.
Do you ever get any headaches?
I did get a couple. I usually never get headaches, but I did get a couple headaches. It was like in the back.
Those are mostly tension headaches. Will start in the back, and tension headaches are coming from the musculoskeletal system, so we're in the right place for those. All right, so have you ever had any pain that goes down your arms?
No.
All right, do you take any pharmaceutical medications?
No.
Have you ever taken any?
Yes.
We can cut this out if you don't want it.
Okay. I just don't remember what the medication was if you're gonna ask me.
Oh, okay. What was it for?
It was for ADHD.
And then you got off of it?
Mm-hmm.
How did you get off of it?
I just decided I didn't want to be on pills anymore. I wanted to try and like see if I could work on it on my own.
How's that going?
It's like highs and lows. Like it's kind of hard to control.
Okay, good. So it's challenging. Working on it. I admire you. Yeah, good job. Okay, do you mind if I leave that in? Because that's inspirational for people. Mm-hmm. Have you ever had any major injuries?
I used to do horseback riding a while ago, and I fell off a horse, and part of my finger came off. So I had to go to the hospital to get that fixed, but I've never broken any bones.
Okay. Cool, good for you. Did the horse step on you? Or?
I have no idea what happened, to be honest. The horse just made a sharp left turn, and I fell off near the wall of the indoor arena, and I have no idea. I did get in one car accident. I wasn't driving, but this was maybe 5 months ago, and no major injuries or anything. I was in the back seat, and the car flipped this way, and I was kind of facing forward because I was on my phone. Headrest of the driver's side, my head was kind of there on it, and then it twisted my neck.
Just looking at your spine, there's a little bit of a postural change here, a little bit too much looking down. Now the postural changes may have happened because of the car accident. After car accidents, it changes the shape of your spine because of the injury to the ligaments. And then you just have this dryness in the skin here. You have all the heat is right here in between your shoulder blades. As we come up to the neck, it's actually not as bad. It's still warm, but this is where it's the warmness, and then it significantly drops off. And then where this dry skin is, it's actually almost cold, but it's very dry here, and the dryness is significant as well. All right, I'm going to push into your spine a little bit. Okay, we'll start with the SI joints. I'm going to place my fingertips on the top of your hips, okay? Any tenderness here?
A little bit.
And what compared to this side? Same, more?
It's a little less. That side hurts more.
Good joint play here. Not too much stiffness in your spine. There's no red flags, no pinched nerves, no herniated discs. It's very straightforward musculoskeletal. Okay, I'm going to dig a little bit deeper into the muscles of the spine. You're going to feel my fingertips on the back of your hamstrings, okay? Good. You're going to feel my fingertips here. I'm going to trace up to the bottom of the glute fold. So no internal or external rotation, just possible movement of the right ilium posterior and inferior like this. All All right, looking at the feet first. During the toe off, there's an inversion on the right. The very last stage, there's like kind of like a little giddy up, and then it's causing the knee to buckle inwards on the right. Yeah, confirmed. Lower right leg extremity. The left leg does not do the same thing. The left foot looks normal. On the left foot, there's some medial movement. It just like moves in towards the midline. All right, looking at the shoulders. Go ahead and keep walking. Normal arm swing both sides. The shoulders look almost even from left to right. Overall, pretty good. The right leg is short. That confirms the standing glute test. Let's look at the pelvis here. Do you have any pain, tenderness? I'm going to push into your sacrum, okay? Do you have any discomfort, tension when I push here?
Not really, a little bit.
Okay, how about the left side here?
Yeah.
More on the left?
Yeah.
Okay, I'm going to push now into your L5. Any pain, discomfort there? Here. Okay, right or left? Do you feel one more than the other?
Left.
Here, left or right?
All right.
All right, I'm going to put blocks underneath of your hips. I'm going to push down into your left hip again like I did before. Do you still feel that same tension?
Not so much.
Okay, that's good. So we removed some of the tension in your pelvis by putting the block underneath of you. Nice and gentle. Deep breath in through your nose. Okay, now coming up to this trap area where that tension was. Okay, same thing. Gentle breath in through your nose and out. Good. Sinking in shoulders, letting it all go. Okay, deep breath in, far in as you can go. Good. And out. Let your shoulders down. Good. Do that breath one more time, all the way in. Good. And let it all out.
Oh God.
I'm going to bend your knees, okay? Don't help me. Let me do it. Right, short. Evens out. As you breathe out, I'm going to bring this hip down, and then we're going to push like that, okay? Down. Lay on your back. Bring the hip down like this, and the shoulder up like that, and then push, okay? Lay on your back. Okay, right is still short. Go ahead and turn your head to the right. It gets longer. Go back to center. Now turn to the left. That evened out your legs. It's telling me your head wants to move in that direction. Go back to center. Now bring your right ear down to your shoulder. Good. That also brought it closer. Back to center. Left ear down to your shoulder. Do the left side first.
Ooh, I'm scared.
Okay, good. That's fine. It's okay to be nervous.
Yeah.
I could barely tell. They're so good. All right, so let's practice one just like the other adjustments, okay? Okay, so I'm going to bring your head over to like right there, and then nice and gentle. I'm just following your breath like the other adjustments, and then from there we push in that direction like that, okay?
Okay.
Okay, nice and gentle. I'll do it even more gentler than the other adjustments, so.
That was quick.
Nice and gentle. We're going to do the right side here. This is what it feels like, just moving through your spine like this, range of motion. Good. We're going to push like that, okay?
Okay.
You're doing great. You're going to do fine. Okay, deep breath in and out. Good. Let this relax. Good.
Oh my God. It's like so loud in my head.
It's right there. Hold on. Just let it all drop.
I don't think it's gonna crack.
Why?
I don't know.
Don't say that. One more time. Good job. Let the feet relax. Good. So we start with the ileocecal valve. This is the window in between the large and the small intestine. I'm going to first put my finger on your belly button here, and then your ASIS, the front hip here. We connect these 2 points. That's where we start looking for the ileocecal valve. Okay, breathing. Bring your chin down to your chest. I'm going to reach around the front of you. Okay, I'm going to hold onto your elbow like this. Lean forward and just like shoulders relax. Good, same thing, chin to your chest. Lean forward just a little bit. You alright?
Yeah.
Those are a little tougher, huh? Can I lift up your
Oh, I know what this is.
Your face when you said that was great. Okay.
Can I hold this?
Nah, don't hold that. You don't.
Okay.
You don't want to hold on. You don't want to be. You want to let it go. You want to be in the flow. Breathe. It's okay to feel it. That was amazing, by the way. It went all the way down. I felt your entire spine move.
Yeah, so did I.
Oh
my god. Huh?
In ways that it's never moved before.
Jeez.
Relax, dude.
I can't
Where are you
breathe.
trying to go? Neck.
It was fine. I feel like it's kind of like hurts a little bit. It's fine.
It's okay. You're allowed to feel it. It's a big, powerful adjustment. Low back.
Still, like it's the same in my neck. Like it's like
Mm-hmm.
kind of hurts a little bit. Is it normal for her? Or?
Yeah. Absolutely.
Okay.
All right. Do a hamstring stretch.
I didn't get to stretch today, so. Yeah, I think a little bit better. It doesn't feel as strained, like in the lower part.
Good.
I feel like that sounded good. The only thing I'm worried about is like my shoulders.
Okay. Tell me about what worries you.
Like when I get older, I'm gonna be like a hunchback.
Mm-hmm.
So.
People in your family have it.
No, but I've been slouching a lot.
Okay.
And I can't get it out.
Okay. Can't get it out.
Yeah, no.
Like it's in something that's inside of you. Like it's taken over your postural control systems.
Yeah.
Can you sit up straight? I mean, like you've got really good posture right now. When do you slouch typically? When you're in school? When you're driving?
When I'm at work.
Okay. What do you do?
I stand on the computer. On top of that, I have to lift stuff.
Does it bother your low back when you lift things, or is it still up in your shoulders?
When I bend down to like lift something, it's my lower back.
Okay, very good. All right, so have you ever had any pain that goes down your arms? Any numbness or tingling in your fingertips?
No.
Any pain that goes down your legs? Any numbness or tingling in your feet?
No.
All right, have you ever had like really bad pain in your neck? Have you ever like woken up stiff in the morning?
No.
Any car accidents?
No.
Any injuries or anything that you can think of?
I did pull my shoulder that 1 week while I was working trying to lift something.
All right, how long ago did you pull your shoulder?
Like 3 weeks.
How's your digestive system in general?
She gets pretty loud, you know. She's like, I don't know. She gets loud though, but it's not anything weird.
Okay. Pain?
No.
Okay. Have you ever been to a chiropractor before?
No.
Okay, how do you feel about it?
I'm kind of nervous. Hopefully you don't do anything.
You used to watch chiropractic videos.
Yeah.
Why did you watch them?
It was kind of satisfying to see. Like, I remember this one video, like, he had, like, a hunchback, and he cracked his back all the way straight, and it was kind of cool.
Oh, yeah, the kid who was, like, super bent over.
Yeah. And then, I don't know, what was he, like, 5'10" at the end of it or something?
Mm-hmm.
I don't know.
You want to be a little taller after this?
Yeah, I don't mind.
One of the keys to all this, your posture,
Yeah.
is definitely just, you're in control of it. That's all in your mind. And, like, if you've been standing at a computer for 40 minutes straight, then it's hard to do that stationary, to like really be still.
Yeah.
And so standing is like allows you to be a lot more flexible. Like with your hips, you can stand up, you can extend, you can flex, you can go back to back. It makes sense to take a little break and stretch out your spine. So I think most importantly for you is to know that posture is all in your head. It's all you just being present with your body and just like recognizing what you've already done. You've already come here with the notion. Let's not be worried about your shoulders anymore. Let's be in control of your shoulders. It's not that complex. It's challenging sometimes, but this isn't complicated. It just takes work over time. And like every time you correct that, you're strengthening the neurons in your brain that recognize your posture. High left shoulder with a little bit of lean to the right, like a C curve. Yeah, you can come back this way. Okay, so you're conscious of that. But lots of motion in the hips, though, slightly accentuated towards the right because of that C curve. But all mild, Charlene, nothing that you have to worry about.
Okay, good.
The feet look straight, symmetrical, and bilateral. Go ahead and go that way. Heel strike, mid stance, and toe off all look symmetrical for the feet. Go ahead and come back this way. Yep, just the high left shoulder and just a little bit of... Does your left shoulder hurt more than your right shoulder?
No, but this is the one I pulled.
Okay, so just looking at your spine, Charlene, I can see your shoulder blade is higher, but I don't see any curvatures in your spine. That would tell me why you would have that lean. Does this feel the same as this over here?
No.
You feel the difference, right? A little bit more tension on this right side.
Mm-hmm.
Can I do a temperature evaluation of the back of my fingers? Much warmer in the upper thoracic spine. And then just a little bit of heat in this lower left. Okay, I'm going to push into your SI joints. Do you have any pain, tenderness, discomfort here?
No.
Lower SI, any pain, discomfort, tension here?
No.
Right side?
No.
Pain, discomfort, tension?
No.
Pain, discomfort, tension here?
No.
Okay, looking from the top for external or internal rotation, they look very close to symmetrical, but the left cheek comes out further like this. That means the left one is maybe rotated external or the right one internal. But when you're moving your knees, opening and closing, the right one was stuck, which means this would be the IN that we're going to look for on that right side.
Okay.
Looking for curvatures or scoliosis here. You have no rib humping. It's very symmetrical. Spine is nice and straight from top to bottom. Okay, left or right? Do these feel the same to you?
No, right feels different.
How does it feel? Tender, harder, looser?
Tender.
I'll put you okay. Yes, just like that. Do that same exact thing. Take a deep breath in and let your shoulders relax as you breathe out. Okay, nice and gentle. Breathing in through your nose. But let's just stretch it one time here. So like you're gonna go like that. I'm gonna really bring this down. And then from there we push, okay? Good shoulders. Good. Can I lean back? One more time, deep breath in. Good, sinking, good.
Was not expecting that. I feel like you snapped my neck.
This is gonna be the big one. Good, good, let it go. Good, good.
I feel like that sounded good.
This is what you're gonna do. You're gonna squeeze my fist in between your knees as hard as you can. Squeeze. That was it, right? Did it crack a little bit?
Yeah.
First thing we do is the ileocecal valve. This is the window between the small and the large intestine, because where the small intestine goes into the large intestine. If you're having stomach issues at home, you can do an ileocecal valve release. And lots of people have done that from learning about it from these videos. All right, so how we find that is first you have one finger on the belly button. I'm going to put a finger on your belly button, okay? Okay, and then the ASIS front hip bone, we connect these 2 points. This is where we start looking for the ileocecal valve. Yours is here, yours is active. You feel everything underneath of it right there. Into your belly. Out. And out. There we go. Okay, next, let's feel how it's not there anymore.
Yeah.
All right, so next is the pyloric sphincter. This is where the stomach empties into the small intestine. Yours is very active right now. Did you eat recently?
Yeah.
All right, so this is a diaphragm release, so keep breathing into your belly. Out. Just like the other adjustments. Oh, just grab both your wrists. Just like the other adjustments, okay?
Mm-hmm.
Keep your teeth together, jaw relaxed.
I've never seen this in my life.
I thought you were going to start crying.
Almost. Yeah, it feels good. I feel looser.
Oh. Oh. Whew. Oh. Mm. Mm. Mm.
Okay, just observing the spine first. We're going to look at the height of the shoulders through the scapula. The left scapula is higher, so you do have a higher left shoulder here. I can just see all this tension bunched up here. Okay, I'm going to do a nice gentle scan on the top of your spine. Good, all the tension's up here in the upper back. You can feel it come trailing all the way down here, even into the thoracic lumbar. But definitely focus tension as we come up towards the neck here. Very symmetrical, but much warmer at the top of the spine, whereas the bottom. This is kind of cool, temperate, maybe just a tad dry too. Okay, I'm gonna push a little bit deeper into the muscles. Right here in the mid-thoracic spine. There's just a slight little curvature. This is why you have the high left shoulders, because your spine comes down like this. It's very slight. Okay, I'm gonna palpate the SI joints. I'm gonna lower your waistband just a little bit, okay?
Okay.
Okay, do you have any tension, tenderness here?
Mm-mm.
Right SI here. Go lower SI here.
A little.
Left lower here.
Little.
So a little bit of tension at the S4 level of S4. I'm going to push into your spine here. Testing the motion. As soon as we get to here, this one right here starts to stiffen up. Good. Not a lot of motion in here at all. So we're definitely decreased range of motion. That's why that adjustment was uncomfortable. We're going to make sure you're nice and relaxed. We're going to measure your pelvis and see if there's any rotations. I'm looking from the glute fold. We're lower on the right side. That means your right hip is going back like this.
Okay.
And then looking from the top, the left glute is out further like this. That means your right hip is possibly going external.
Okay.
Go ahead and let your head relax. Good. No deviations to the left or right, but slight hyperkyphosis here. Go ahead and stand back up. Okay, I'm going to bend your knees. Try not to help me, okay?
Okay.
Don't fight me, but just let your knees bend. There you go. Do you have any pain, discomfort when I push here? Upper SI joint. Any discomfort here? Tension. Left SI joint. Any tension here?
A little bit.
Any discomfort here?
A little bit.
Okay, a little bit more on the left. This is a little squishy in there. You feel that? A little bit of swelling on the left SI joint. Okay, nice, gentle breathing. And I'm just going to work some of the soft tissue here. These are the trap fibers. These are fibers from the trapezius muscle, big muscle. Goes all the way down to here, all the way out to your shoulders. A little tender up here. How's the pressure there, okay?
I can breathe better. Take that as a good sign.
One more at the top here. We're going to move your head over to the side like this and just try to let your head and neck completely relax. Was it painful?
Mm-mm.
All right, let's do it one more time.
Oh. Oh. Lord.
Bottom leg stays straight. I'm going to scoot you forward here just a little bit.
Okay.
We're going to pull this out like this just a little bit too.
Oh. Whew. Whew.
It's pretty awesome.
Yeah.
Okay, lay on your back.
Whew. Oh. Whew. Whew. I'm shaking from that one.
You left-handed?
I mean, I can write on both, but I Right side more dominant.
Okay, bring your right ear down to your shoulder. Back to center. Left.
I feel pretty great right now. It's like recovering from being cracked, that's all.
Don't try to help me. Let me do all the work. Good. We're just going to move your head over to the side like this. Good. And then let your head drop. And then we're going to push just like that, like right there, okay?
Mm-hmm. Oh!
Yes.
I've waited so long for somebody to do that.
7, 6, 5. Where do you feel it more? Here at 2 or down here at 7?
Honestly, I feel it all over.
Good. Let your shoulders drop and head drop. Gentle. This right here, you're holding on just a little bit. Try a soft breath. Good. Let it all go. There you go. That was the good release right there.
Mm. 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 Oh. 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 Wow.
Okay, good adjustments there. We're going to do the ankle adjustment now. For this one, we just pull in this direction like that.
Oh. Oh. Oh.
As far as you can, squeeze.
Oh. Ow.
Start with the iliocecal valve. We find this by first locating the belly button and the ASIS, the front of the hip. Connect these 2 points. In the middle of those 2 points where we start looking for the iliocecal valve. Yours is here. Yours is active right now. It's a little tender. Okay, we'll just work this out. Good again. And out.
Oh. Oh. Holy sh. Oh. Oh my god. Woo.
Did you feel it all the way down?
Yeah. Whole way down to my tailbone. Ooh. Woo. I'm ecstatic right now. I act like a normal person right now. Oh, I feel great. Fantastic. I feel like I could go run a marathon now. I feel like I have flexibility now. I love the fact that I can breathe. I feel like a little kid at the candy store.
Push, push, push. Hard you can.
Oh.
Right side push. Go loose. Let this go. Good. Go let it go.
Oh. Oh. Oh.